Welcome everybody. It is September 1st, 2020, and do you know what that means? It's actually the beginning of Prostate Cancer Month. Welcome. I want to introduce myself. My name is Dr. Lance Walsh. I'm a urologist at Titus Regional Medical Center at the Advanced Urology Institute. And with me today is Katherine Rolon, who is a nurse practitioner who also works at the Advanced Urology Institute. And we've prepared for you today a short presentation on prostate cancer screening, which is very important, okay? Bobby, let's go ahead and start the slides. Prostate cancer is the most common solid organ malignancy in men. In fact, there's over 230,000 cases each year that are diagnosed. It, however, remains the second leading cause of cancer death, second only to lung cancer, about 26,000 cases or deaths a year from prostate cancer. So it's a very relevant topic. Prostate cancer is a common cancer, but it's also a cancer that can kill. The good news is that we have ways to screen for prostate cancer. PSA stands for prostate specific antigen, is a blood test that we use to screen for prostate cancer. And epidemiological studies show that since PSA was introduced in the early 1980s, that although initially the incidence of prostate cancer increased, the overall death rate from prostate cancer has decreased since the introduction of the PSA screening test. Worldwide, the benefit of PSA screening has been shown in countries where PSA screening is actually performed, like the United States and Canada. In other countries where prostate cancer screening is not performed, we don't see the same reduction in death rates. So we've asked Katherine to do a short presentation on traditional prostate cancer screening.
Hi, so as Dr. Walsh was discussing, with the formulation of the PSA blood testing, traditional prostate cancer screening is started at age 50 in the average man and can be started at age 45 in a higher risk man who has family history of prostate cancer. So what is involved in the prostate cancer screening? A blood test and a physical exam is required. The blood test being the PSA, which can be elevated in incidences of prostate cancer. It is not necessarily specific to a prostate cancer, so it can be elevated for other reasons. Regardless, anytime there is an elevation in the PSA, it warrants further investigation, and you should have your urologist check things out. The digital rectal exam serves a purpose in this cancer screening as well. So most prostate cancers occur in the peripheral zone, about 70%, which is on the backside of the prostate. So a rectal exam helps us evaluate that area where cancers like to grow and assess for especially firm areas of the prostate or nodules that may indicate a cancer. So these two things together, a blood test and a physical exam, are a proper cancer screening and should be performed at least annually for men 50 or older or 45 or older in higher risk patients, and may be performed as needed if you're developing new urinary symptoms such as blood in the urine or more irritative urinary symptoms.
Hey, thank you, Katherine. I'd also like to add that there is a newer modality that we can use to screen for prostate cancer. Maybe you've heard of it. It's called a multiparametric prostate MRI. An MRI stands for magnetic resonance imaging. This test isn't invasive. It's done in your local radiology center. The benefits of an MRI is it can identify a suspicious area of prostate cancer that can then be biopsied. It is very sensitive and specific for prostate cancer. In fact, it's the most sensitive test we have to detect prostate cancer. There's a variety of indications for a multiparametric MRI. These include if you have an elevated PSA or your PSA is rising, you've had a negative prostate biopsy, you're on active surveillance for prostate cancer, if you've had an abnormal rectal exam and a negative prostate biopsy, if you've already had a diagnosis for prostate cancer, and before treatment, it's important to get a multiparametric MRI to assess the degree of spread of the prostate cancer, either locally or local regionally. And if you've already had treatment for prostate cancer and we're concerned about a local recurrence, a multiparametric MRI may also be indicated in that case. I also wanted to add that we've started a bladder and prostate cancer support group. We've been meeting for the past year. We'd love for you to join us. The next meeting is the first Tuesday in November, November 3rd, and it's located at the third floor conference at Titus Medical Plaza. That's up from the Wellness Center. Also, we'd like you to put any questions that you have in the comments, and we will answer within 24 hours. If you'd like to make an appointment with us, our office is located at Titus Regional Medical Center at the Advanced Urology Institute. Our phone number is 903-434-7111. We look forward to taking care of you and your family. Thank you very much for joining us.